Kim. I'm an economic officer here with the U.S. Embassy in Santiago, Chile. I am joined by my colleagues Willie Bravo and Lucas Jackson, who most of you know as integral members of the U.S.-Chile Science, Technology, Innovation Council, STIC. Thank you for joining us this morning for this important discussion on COVID-19 from a research and development perspective. This is the third installment of the Science Diplomacy Speaker Series, organized in coordination with STIC, a bilateral public-private organization promoting science, technology, and innovation cooperation between the United States and Chile. Our distinguished presenters today are Dr. Peter Kilmarx, the Deputy Director of the Johnny Fogarty International Center at the U.S. National Institutes of Health. Dr. Kilmarx is joined by Jamie Nishi, the Director of the Global Health Technology Coalition. We are deeply appreciative of both our speakers and their willingness to share their expertise with members of STIC and invited guests. This morning, I have the distinct pleasure to introduce our Charge d'Affaires, Rich Glenn, who arrived in Chile in August. Charge Glenn is a career member of the Senior Foreign Service with deep knowledge of the Latin American region. He most recently served as Deputy Assistant Secretary of State in the Bureau of International Narcotics and Law Enforcement Affairs in Washington. Previously, he served in the U.S. missions to Mexico, Argentina, Ecuador, South Africa, and the Czech Republic. He is a native of the state of California. Charge Glenn, thank you for joining us today.
Great. Craig, thanks so much. Thanks for the introduction. It is excellent to be here with you all this morning. To our U.S.-Chile Council on Science, Technology, and Innovation, to our guests, and to our two speakers. Thanks for joining us this morning and being a part of this effort and this initiative. As Craig noted, I recently arrived. I've been here for 3 months. A third of it has been spent in quarantine. But despite that, Chile is a wonderful country, and it's great to be here. And it's just a great opportunity for me professionally and personally to represent the United States to the Chilean people. I want to thank the members of the STIC for supporting and organizing these important discussions. I believe this is the third activity under the Science Diplomacy Speaker Series that we've sponsored. Your partnership through the STIC is really deeply valued by the United States as well as by the Chilean government and the Chilean people as well. And I'm excited about our continued cooperation. I also want to thank our STIC members. Many participated last week in a roundtable discussion with Undersecretary Keith Kroc, who is here speaking about the importance of secure networks and the future of 5G, and the STIC members played an essential role in that visit, and I thank you for that. The United States and Chile, we really do have a robust and collaborative relationship on science, on technology, and innovation. The STIC is really a first of its kind public-private entity between the United States and another country. It supports the expansion of our partnership in this key area and promotes entrepreneurship and sustainable development for our mutual benefit. The sharing of information, experiences, best practices, those are among the main tools we are using in pursuit of this collaboration. And I think that this idea is exemplified by our session here today. Under the current challenging times, U.S.-Chile and international collaboration is really crucial, especially in the area that we're going to discuss today. We have a long and deep history of collaboration on health sciences and research and development. In fact, the U.S. National Institute of Health, NIH, and other science-based U.S. agencies have a strong network of collaborations here in Chile. The NIH has provided funding for more than 60 research and development projects over the years in health sciences, and those have been carried out by Chilean scientists here in Chile. Before I turn the time over to our MC, to Lily Bravo, let me express my deep appreciation to STIC and its members for facilitating these exchanges on science and health collaboration. I want to thank our two distinguished speakers, Dr. Peter Kilmarx, the Deputy Director of the Johnny Fogarty International Center at the National Institute of Health, and Ms. Jamie Bay Nishi, the Director of the Global Health Technologies Coalition. Thanks for being here, for sharing your experiences and your expertise. I also want to extend a thanks to our embassy team, to Craig, to Lily, to Lucas, who really have just made this into a real success and a model, not only for us here at the embassy in Chile, but for other embassies and other entities within the State Department. So thank you for the great work that you're doing here. We often hear that science has no borders, and this session clearly demonstrates that that is true, and in an area of utmost importance to us all during this challenging period under the COVID-19 pandemic. I'm looking forward to participating and hearing what we're gonna hear today. So, thank you so much for joining us. And Lily, over to you.
Thank you, sir, and thank you everyone that joined us this morning for our third session of the speaker series. Today, we have an interesting topic to discuss and to hear from very relevant actors that know exactly what's going on within the ecosystems in the United States and collaboration at international level. Our session is titled COVID-19 from an R&D perspective. We're going to be seeing two sides of that. What is international health science and scientific collaboration per se, and the impact of COVID-19, but also we're going to hear from another, like, more sort of private-public association working on that, and in that presentation, we're going to be exploring the multilateral R&D ecosystem from a policy focus. So today, I don't want to take much of your time, especially the valuable time of our presenters. I would like to start by introducing and passing the screen. I'm going to say the floor because now it's a screen, thanks to the technology, actually, to Dr. Peter Kilmarx, Deputy Director of the John Fogarty International Center at the National Institute of Health. Dr. Kilmarx is an expert in infectious diseases and has served since 2015 as Deputy Director of the Fogarty International Center. He has a long previous history working on this by leading different positions at CDC and also some other programs in medicine, like the Thermal Combined Program in Medicine and other experience in Johns Hopkins Hospital. So he served 23 years in public health service. So I'm sure we can learn a lot from your experience. So we'll start with you, sir, and thank you for taking your time and sharing your experience.
Terrific. Thank you, Lily, for the introduction, and really want to thank the Embassy for organizing this session and this opportunity to speak to the group. Thanks to Charge Glenn for introducing us and opening the session. I'll go ahead and share my screen. Great. So I'm going to talk about our international collaborations from the perspective of Fogarty from the U.S. National Institutes of Health. And just want to start with mentioning the mission of the NIH. The NIH is the largest funder of biomedical research in the world, and it's really a two-part mission. Sorry, I'm trying to clean up my screen so I can see it. There it is. So the first half of our mission is really focused on the basic science, the fundamental knowledge, so innovations like CRISPR-Cas or cryo-electron microscopy. And then it's the second half of the mission that's the application of that knowledge to improve health. At the NIH, our headquarters is in Bethesda, Maryland. I'm at home about a mile away. I haven't been to the office for many months. There's 27 different institutes and centers, and really for every major disease type or organ system. But I just want to highlight the largest is the National Cancer Institute, the National Institute of Allergy and Infectious Diseases, and then we're here as the Fogarty International Center. And what we do at Fogarty is we with our own appropriated resources, we focus on training and capacity building in lower income countries, but then we support the NIH and all of the extensive international collaborations from NIH. And just want to emphasize over the next few slides that global health really is a priority for the NIH. The NIH director, Dr. Francis Collins, when he started 11 years ago and was asked about his priorities, he did highlight that number 4 here is expanding research into diseases affecting the developing world. So really a strong personal commitment from our director for global health research. And one might ask, why is a U.S. institute interested in global health research? Why is this a good use of U.S. taxpayer money? And it really is. There's unique populations and disease presentations around the world, different genetic backgrounds, very important, unusual exposures and environments, infections particularly. We need to learn about infections where they arise and can't wait until they come into the U.S. There's unique interventions we can learn from. The insights of a diverse set of investigators, the best scientists, aren't all in the U.S. There's large patient populations that can be enrolled in studies, alternative health systems, and within the U.S. there's a very strong interest in global health research among students, trainees, and early career researchers. So it's really our future workforce. And just this panel here is an important example of this advantage and imperative for global health research. This is from a New York Times article about a large family, thousands of family members in Colombia in South America, and they have an autosomal dominant inherited form of Alzheimer's disease. So they can be tested and know exactly who's going to develop Alzheimer's disease. And so for looking for biomarkers or for testing interventions, it's been a very important, it's obviously very unfortunate for those individuals, but an important global resource to be able to speed this research. And just an example from infectious diseases about the importance of building research capacity. When there's an outbreak, we need to learn about the pathogen and the epidemiology and the treatment. This is looking at the numbers of publications in different countries following an outbreak. So in West Africa, in Guinea, where there was quite weak research infrastructure, in the first 2 years of the Ebola outbreak, there were only 42 articles that had a Guinean co-author. And in contrast, in Brazil, where there's quite good research capacity, in the first 2 years of the Zika outbreak, there were over 200 articles with a Brazilian co-author. This is a logarithmic scale. And then in China, where there's very good research capacity, just in the first 6 months of COVID-19, there's been nearly 3,000 articles with Chinese co-authors. And it's remarkable how much and how quickly we've learned about COVID, based in part because of the very strong research capacity in China that got us off to a running start. In the Solidarity trial, the WHO-led COVID-19 treatment trials, it's remarkable that it's started in 23 countries, including in 12 lower and middle income countries. And in the Americas, Argentina, Brazil, Honduras, and Peru have all taken part in the Solidarity trial. So it really is a global enterprise and a global collaborative enterprise. We've been able to make a map. We just developed some very basic indicators of research capacity. And so making a map of the world to see where the kind of holes in the map are, where we need to build capacity, Central Africa, Central Asia, Central America, and along the Caribbean are some of the areas where the capacity is weaker. And I know Jamie will talk more about this imperative for research capacity for pandemic research. Again, from the NIH, just to emphasize how global our work is, in the last fiscal year, there were over 12,000 international collaborations with the extramural grants from NIH. This has been increasing in all regions. The greatest collaborations with Europe and Eurasia, but it's really all regions where we have collaboration from NIH and an increasing trend. We looked last year, we wanted to see what percentage of NIH-funded publications had a non-US affiliated co-author, just to see the extent of the global reach of NIH research. I thought it would be 20% or so. What we found is that 35% of all NIH-funded publications had a non-US affiliated co-author, so it really is a global enterprise. We also found remarkably that the papers that had both a US and a non-US affiliated co-author, those papers had the greatest citation impact score. So this is a measure of impact, and these papers that are collaborations, international collaborations, have a greater scientific impact than the papers that are with US authors only. Overall, maybe not surprisingly, China was the greatest collaborator, and that up from fourth place to now in the lead in terms of these collaborations. The other countries with the highest numbers are largely high-income countries. And then for the low and middle-income countries, other than China, you can see Brazil, Mexico, Colombia. My screen is hiding behind my video, but you can see that it's also with lower-income countries, a lot of collaboration and publications. I want to make sure you're aware of this resource, this online resource. It's called World Report. It's worldreport.nih.gov. This is an online mapping tool that maps all the directly funded grants and indirectly funded collaborations from the 12 leading research funders in the world, so NIH, but also the Gates Foundation, the Wellcome Trust, and others. And so it's over 15,000 research institutions in 195 countries with over 400,000 program records. I just searched, and there were over 1,200 of these in South America. And then for Chile, there's 66 collaborations at 30 different research institutions. And this is the breakdown of the funding for these international collaborations in Chile. So it's the NIH, but also the Wellcome Trust, the European Commission, and the Canadian Institute for Health Research. So if you want to look up who's funding what where, or who's funding a particular disease in the world, this is a great resource. And then just with the NIH collaborations in Central and South America, it's over 1,200 projects. The greatest number of collaborations is with Brazil, but also Peru, Argentina, Mexico, Colombia, and Chile is at 4%. So there's room for growth. It would be fantastic to see more collaborations with NIH funding in Chile. It is up to about 60 per year of these collaborations. It bounces around from year to year. And would also note there's 10 Chilean researchers that are actually at NIH working in our intramural laboratory. So that also we would welcome to have more Chilean researchers coming and spending time in our laboratories at the NIH. Just looking at the different institutes for these collaborations with Chilean scientists, number one is with this is National Institute of Allergy and Infectious Diseases, but also cancer, mental health, general medical sciences, heart, lung, and blood. So it's really, I think it's 18 different NIH institutes and centers that fund collaborations with Chile. So it's really quite diverse. But again, there is room to increase this just to be more on par with other South American countries. I also just want to mention a collaboration following the earthquake and tsunami in 2010 that NIH donated surplus scientific equipment to Chilean universities. This was coordinated by the Chilean embassy, and FedEx did the shipping free of charge, and the equipment was sent to 4 universities. So shifting now to COVID, This is looking at this on the left is looking at COVID in South America. We can see there's now over a total of 10 million cases as of yesterday. In looking at the new cases, this is sorted by the number of new cases, 58,000 new cases just yesterday, and this is sorted by the countries with the highest number of new cases yesterday. And so you can see where things stand in terms of where the new cases are. The total deaths over 300,000, and this is the total death to date per country. I understand that things are relatively under control in Chile, so congratulations for that. We in the U.S. Should have some humility in what we can learn from other countries about how to manage COVID. We are seeing globally now about 600,000 new cases per day and 9,000 up to 10,000 deaths per day worldwide. So really, we're in an intense period on a global basis. And then looking at this map of the world, this is the rate in the last week. So it's the cases per 100,000 in the past week, and we can see how it's really Europe, North America, and South America are the real ongoing hotspots now for COVID transmission. The U.S. research, there's some major initiatives for the U.S. countermeasure research on diagnostics and treatment in vaccine. Congress appropriated about $3.6 billion for this research, so really a very good investment to invest billions to let trillions of economic and social activity get back to normal. The overarching program from the U.S. is called Operation Warp Speed. This is a public-private partnership for the development, manufacturing, and distribution of the COVID-19 countermeasures, and it's a number of agencies in our Department of Health and Human Services, but also Department of Defense and private industry, and with a focus on having vaccine available for Americans by January, which this is on track to produce. Within the NIH, the main initiative is called Active, Accelerating COVID-19 Therapeutic Interventions and Vaccines. This is NIH with pharmaceutical companies, including international and European companies, with other agencies, and with the European Medicines Agency. So it really is an international collaborative endeavor, and with a framework for vaccine and drug candidates and coordinating the regulatory processes and leveraging assets. So it, again, really is an international collaborative effort. And then for diagnostics from NIH, this is called RADx, Rapid Acceleration of Diagnostics. And this is developing innovations, new technologies with a goal of having millions of tests available by now, fall of 2020. And this has also been quite productive. We now have an at-home rapid test that's been authorized by the FDA. So this has also been a very active and heavily funded activity. The good news you've probably heard about, but I can go through a little bit of the details about the vaccines. This is the news just in the last few days. These are messenger RNA vaccines, so it's an innovative technology. The vaccine is actually the messenger RNA for the protein, and then it gets into the human cells and develops the protein that then is the basis of the vaccine, of the immune response. So these two that are in the lead in terms of their results being announced are both using this mRNA technology, and it's the spike protein on the virus, which looked like it would be a good target for vaccine development, and that is shown to be the case. So the Pfizer vaccine, it's 2 doses, 21 days apart. The vaccine efficacy is 95%, which was remarkable. The target was over 50%, so 95% is fantastic. There were 162 cases of symptomatic disease in the placebo recipients and only 8 in the vaccine group. And then for severe disease, it's important to also prevent severe disease. There were 9 cases in placebo recipients, 1 in the vaccine group, so that was also very effective. And also important, the vaccine efficacy was high in those who were older, age 65 or above. One of the real challenges is the storage requirement for the Pfizer vaccine is at -70, which is going to be a challenge even in high-income countries for the distribution of this vaccine. So the Moderna vaccine, again, a very similar mechanism of action technology. It's 2 doses, 28 days apart, also very high vaccine efficacy. Almost all the cases, all but 5 in this study were in the placebo group. All of the severe cases were in the placebo group. Also, no difference in the efficacy by age, so also effective in older people. And by ethnicity, we've seen a much higher impact of COVID-19 in racial and ethnic minorities in the U.S., so this is an important finding. And then very important, the storage is less restricted. It's at -20, so like a household refrigerator. And so this will be an advantage for the Moderna vaccine. I just want to close with a couple of thoughts, a couple of messages. One is really the importance of staying informed and being aware of misinformation. And I think especially for this group, as those interested in science and technology, you need to be the smartest people in the room or in your circle of friends. As Dr. Tedros said, we're not just fighting an epidemic, we're fighting an infodemic. And there's tens of thousands, now probably much higher, posts on Twitter of inaccurate information. So please be careful of what you read, but especially be careful of what you're sharing. And don't be the person sharing false rumors and incorrect information. And then lastly, it's important to think about mental health and taking care of oneself. This is a long haul. We're about 8 months into this, and we could have as much as 8 months to go before there's widespread vaccine use. So really need to pace ourselves and take care of ourselves and our families and the people that work for us to make sure that everyone's taking care of themselves physically as well as mentally. This is my wife and I playing Kadima in our driveway in the afternoon just to take a break. And I think this is helpful if stress is really getting in the way of daily activities for several days in a row. That's a indication to get in touch with a health provider. So if sleeping, eating, just normal function is getting affected, that's an indicator to get care, to get help. So I'll just close with this last slide, and these slides could be shared about keeping in touch with us at Fogarty. We really do want to promote international collaboration, including with Chile. And so we have a funding newsletter, a help newsletter, and we're on Twitter and Facebook. So thanks for this opportunity. I look forward to Jamie's presentation and especially to our discussion.
Thank you, Peter. That was a very helpful and enlightening presentation, and good for many of us to learn more about Fogarty and the levels of collaboration. And I totally agree with you. Hopefully we can increase the number of collaboration with Chile. And we're here to support you to also start moving around and connecting everyone, because I guess that's our main role, trying to connect. Just a couple of housekeeping information. There's on your side, there's a tab for Q&As. Please start putting and writing your questions there, because right after Jamie's presentation, we're going to have a period for questions and answers. So please type them there. So now I'm really pleased to introduce Jamie Bay Nishi, Director of the Global Health Technologies Coalition. Jamie leads the coalition's policy and advocacy portfolio, as well as manages its engagement with Global Health Technology Coalition members and other stakeholders and partners in government, the private sector, and the civil society. You might wonder what is the Global Health Technologies Coalition, and I think Jamie can much better explain that to you, but it's the premier advocacy organization focusing on global health R&D for new tools and technologies. But we want to learn and hear more about Jamie's presentation. And again, Jamie, thank you so much for your time, for talking to us. And again, I would also repeat, we're here to help you connect with Chile, and vice versa. And don't forget your questions on the Q&A bar. Thank you.
Perfect. Thank you, Lily. Can you hear me well?
Perfect.
Great.
So,
great.
Yes.
Wonderful. Well, good morning, everyone. Thank you so much to the U.S. Embassy in Chile, to Chargé Glenn, and to the entire team there for facilitating this conversation. We're really honored and delighted to be part of the conversation today. And what great and exciting and big shoes to fill following Dr. Peter Kilmarx, who's somebody I have the utmost respect for and have come to know quite closely during the pandemic as we've been collaborating between the science and the policy of what do we need to do at a global level to support the R&D ecosystem for COVID response and beyond. I'll just start by saying I am not a medical doctor, a physician, nor a scientist. I fell into this job coming from a global kind of tracking the global development ecosystem more broadly, and am very much, as Lily mentioned, focused on the policy side of things. GHTC sits in an interesting place where most of our work is focused on U.S. policy and advocacy and multilateral policy and advocacy. And more in the middle of COVID, we found that we're the ones trying to look at the forest between the trees. And for us, the trees are individual multilateral institutions and government players. So I'll be talking through that a little bit in my presentation today. Just to say also in terms of framing and how does GHTC connect to the work of your council, I saw that in your mission statement, you're talking about linking companies and universities, looking at optimizing tech transfer processes for science, technology, and innovation, looking at tax tools and innovative financing mechanisms, and that's very much in the wheelhouse of what our organization does. So just to dive in, next slide, please. Just to, again, frame up who we are, the Global Health Technologies Coalition works to save and improve lives by encouraging research and development of health technologies. Coalition of 30 nonprofit organizations, and we actually got our start as a coalition of all nonprofit public-private partnership developers of biomedical research, drugs, vaccines, and diagnostics. But we also work with academic institutions and aligned businesses, advancing policies to accelerate the creation of new drugs, vaccines, diagnostics, and other health tools that bring healthy lives within reach for all people. What we mean by that, and in non-COVID times, a lot of our focus is really how do we get medical interventions to low resource settings, to the last mile, to everyone in the world. A lot of our focus has been where the commercial markets fail, where poverty-related neglected disease has not created an enabling environment for pharmaceutical companies and big companies to invest in some sorts of neglected tropical disease research in HIV, TB, malaria. So individual members within our coalition have worked on advancing research in that space. One that has worked a lot in South America that some of you may have collaborated with is the Drugs for Neglected Diseases Initiative. But there are many, many others, and happy to share more if there's questions about who all we represent. I should also note that we are not funded by the U.S. government, nor are we affiliated with them. We get the majority of our funding from the Bill and Melinda Gates Foundation, and so our lens on this is how do we support the broader global health ecosystem, not looking at any specific country level. Next slide, please. So what does it mean to say we're working on policy and advocacy? Overall, obviously, we all know that money and investment in global health research is really, really critical. So we're constantly talking about how do we increase public funding. We're looking at how can we better use the resources that we have and increase coordination, global cooperation, scientific cooperation to advance R&D. We're looking at, as Lily noted, those multi-sector partnerships. How can we bring public-private partnerships together to advance research and product development in this space, and create incentives for all of those partners to be aligned. We're looking at innovative financing mechanisms, and I'll talk about that a little bit today, and I'll just give the disclaimer, I'm also not an innovative financing expert, but we are looking at where a lot of the different moving pieces and players are and how we see that they may connect to strengthen investment opportunities, I think including for Chile. And then finally, and I'll talk about this as well in the context of COVID, strengthening regulatory pathways. How do we get better alignment? Regulatory hurdles are one of the great barriers that have yet to be achieved in responding to COVID-19. And how can we streamline processes, ensure that there are high standards for safe product review and efficacy, but at the same time, often these processes are very slow and very national or regionally focused, and how can we have better alignment and harmonization there? Next slide, please. So the multilateral space where we operate, GHTC started working in terms of multilateral policy and advocacy about 4 years ago. When we started to engage, our priority focus, and this won't surprise anyone, was the World Health Organization. We went and started looking at this large entity and said, okay, where does the WHO touch global health R&D processes? And what can we do as advocates on the outside to help to push for change, again, streamlining, increased efficiencies? And a lot of where we started our work was actually pushing on WHO to create a first essential diagnostics list, which was only launched about 3 years ago. There has been for decades an essential medicines list where the WHO basically gives their gold stamp of approval on a safe therapeutic. There hadn't been a corollary to that for diagnostics. And I think that, we've spent years talking about why it's so important to invest in diagnostics R&D, and now everyone in the world is talking about how they get access to diagnostics thanks to COVID. We're really proud that we were able to be part of that process and have continued to engage with WHO as they expand their list, as they think about how do they evaluate and review COVID technologies, and where do we go from there. We also touch on WHO through regulatory processes like pre-qualification. We've been watching closely the creation of the new science division within WHO, which was really just launched right before COVID hit. So they've been a very, very busy team, but I think a very important one for us to all watch in the months and years to come. And then, of course, WHO is playing a key coordination role on this global effort called the Access to COVID Technologies Accelerator, and I'll get into more of that in a moment. We've also engaged in the UN General Assembly. So you'll see the picture in the middle on the right is this year's UN General Assembly, held entirely virtually. But we do engage in that space as well to the extent that health comes up on the agenda. So obviously for COVID this year, that was priority. But also, we're really focused on how does R&D factor into conversations about universal health coverage, making sure that, part of equity and access to healthcare for all includes advancing and developing the tools that everyone needs. I'll also just note there's last year's G20 Osaka Summit. There in a photo up on the upper right of this year's G20 meetings, and I think many of you may be tracking. Actually, it's a busy week as the G20 ministerial is right on upon us here this week, as well as the Global Health Security Agenda ministerial all this week. So it's quite a busy time for my multilateral team as we're trying to figure out where do R&D investments connect into this work. From the G20 perspective, we see them as a key group of partners who can really make some significant impact in terms of financing R&D, including the COVID response, and we expect to hear some sort of statement to that effect coming out within the next couple of days. And within the Global Health Security Agenda, we're looking to see how R&D linkages can be strengthened, and I'll get into that again in the presentation. Next slide, please. So turning to the core focus of our presentation today, COVID. I want to frame the entire presentation on one premise, which is R&D has been a critically overlooked element of health preparedness in general when we look at the global health security space. We all know that COVID-19 has forced everyone in the world, regardless of what country you're in, to consider the fact that we didn't have the tools we needed when we needed them. And on the left, I hope you all can see it. It's a little bit small, but this is a screenshot from the Global Health Security Index report. And you'll see that the United States is at the top of the list, in terms of last year's analysis. But as Dr. Kilmarx noted, we need to be quite humble because the 250,000 deaths of the total deaths this year have come from the United States. Our case count is surging right now. Our diagnostics capabilities are being overloaded. I had a coworker this week who had a family member wait in line for 7 hours and 22 minutes 2 days ago with a 3-year-old and a 7-year-old in a car waiting to get tested, and that's simply unacceptable. So, you know, it doesn't matter if it's a high, middle, or low-income country we're talking about. We all need greater tools, and we all need greater capacity to access these medical technologies to expand, to respond to COVID and to respond to future crises. So the question that my coalition has been asking is, how do we push for global collaboration to end this pandemic while simultaneously preparing for the next one? World leaders are focused. The G20 is focused on COVID response, and we need to invest now in the short term in solving this current crisis. But we also can't get through this crisis and then just return to work and life as usual. We need to make sure that there are sustained investments in R&D capacity, so that if this happens, we can pivot and we can all respond globally much, much more quickly than we have so far. I have to say, and I'll get into this throughout the presentation, Dr. Kilmarx shared some of the metrics that his team are tracking, and a working group that he's part of called Essence, which is in collaboration with the World Bank, NIH, and the WHO, has created a really important data framework for my community, where they are looking at, as he noted, at, you know, the World Reporter tool, looking at the number of scientific publications in various countries, looking at the number of clinical trials in countries. His team has been absolutely heroic in creating a baseline data set that gives us an apples-to-apples comparison of some R&D capacities. Is it as much or as informed of a story and a picture as we would like? No. But his team has been incredibly clever at trying to figure out whatever basic information we can to have that story, to create that map he showed about the different R&D capacity. And that's been a really foundational anchor to our advocacy work, to tell world leaders, to tell anyone who will listen why this, why this area has been so underfunded or so neglected in a policy space. Next slide. So GHTC has been working with various partners trying to advance this conversation. COVID has created an opportunity for us where global health research and development had historically been sort of felt like it was or looked at as in its own silo, not always seen as part of the broader global health system. We have partnered with one organization called the Pandemic Action Network Group, who have co-authored with us a paper on The Next Pandemic Won't Wait: What World Leaders Can Do to Strengthen Global Health R&D Architecture for Health Security. And we've boiled it down to 4 recommendations, and the way we sequence this is thinking about immediate, medium, and long-term needs for this R&D health ecosystem. So you'll see, I'm going to get into these, and I have a slide for each, but just to highlight, supporting upstream R&D activities and the development of medical countermeasures through the Access to COVID-19 Tools Accelerator. Again, this is the partnership that's hosted through WHO and many other groups. Mobilize sustainable finance for global health security R&D capacity building. So beyond the current pandemic, how do we build back better? Strengthen the GHSA, the Global Health Security Agenda, through explicit inclusion of R&D in its action packages. And I'm very keen to advance this part of the conversation with Chilean governments and stakeholders in particular, and I'll tell you why. And formalize a forward-looking global architecture to strengthen R&D coordination and response. So again, where's that policy framework that we just don't have right now when it comes to R&D? Next slide, please. So starting with the short term, we need to make sure, first and foremost, that the U.S. is invested, as Dr. Kilmarx noted, billions of dollars in COVID response. Individual countries and regional blocs like the EU and the UK and others have invested heroic amounts of money in COVID response. Our focus as GHTC is to ensure that the whole world has access to health technologies and are trying to figure out how to plug and connect as many players as possible. The WHO and the ACT Accelerator partners, and there's a little image of who all those partners are on the bottom right, have noted that we need to fully fund basically $38 billion to the ACT-A by March of next year to advance the product development and manufacturing and then distribution of these technologies. We need to ensure that there's robust global participation and representation in ACT-A. And one thing that we're also doing is engaging with the U.S. government and trying to figure out, we know that there's a lot of scientific coordination and collaboration happening, but we would like to see the U.S. formally engaged more in the ACT-A partnership and take a more global frame in terms of supporting the COVID response. We're also spending a lot of time talking about how researchers need to act now to reduce anticipated barriers to equitable product access down the road. And what we mean by that are, and actually Dr. Kilmarx did a really great job outlining some of these considerations when he talked about the 2 vaccine candidates that are being advanced in partnership with Operation Warp Speed that looks so promising. Cold chain. As Dr. Kilmarx noted, even in the United States and high-income countries, we don't have the infrastructure to support the negative 70 degrees Celsius that some of these vaccines require. We've got to figure out the cold chain piece or work backwards to look at thermostability of vaccine candidates to ensure that they can work at a basic refrigerator temperature, household refrigerator, or find some sort of other refrigeration technology solution that's going to work in the lowest resource setting. Dosing is a concern for us. As noted in the two examples that Dr. Kilmarx showed, that both of those candidates require 2 doses. We're very concerned about countries. Let's say one country receives access to 3 different vaccines which require dual dosing. How does a patient make sure that when they got a shot in the arm for one vaccine, that when they go back to a clinic 20 or 28 days later, they're getting the right part 2 shot and that they're matching that up correctly? Huge, huge concern. There's really big concerns about having enough pharmaceutical grade glass in the world and creative solutions being advanced along those lines, including trying to come up with basically 20-dose vials to preserve the glass and to work on getting the volume of vaccine out there that the whole world needs. And regulatory hurdles, even things that sound as simple as labeling, trying to figure out how proper labeling of these products can sort of coexist to get market entry quickly of products through in multiple language, in multiple regulatory systems. And I understand that with WHO, with manufacturers, and with a lot of different government partners and regulatory bodies, this is one of the biggest challenges. We don't want to end up in a situation where the scientists have done their part in actually getting successful and highly effective vaccines across the finish line, perhaps now, perhaps as soon as January, have them clear regulatory hurdles and then get stuck in terms of regulatory piece. We need to be looking at these solutions now and making sure that we waste no time having to relabel vials to fit different regulatory review processes. And again, this comes back to WHO. We see them as playing a really important role in helping coordinate some of that effort. We also want to make sure that we don't take our foot off the gas pedal in terms of why investment in global health R&D are needed. These first vaccines off the line are very, very promising, and we're excited to see them coming out as soon as possible. But we also realize that for vaccines to be most helpful and most useful in low resource settings, it's probably going to be the second line vaccines that need to happen. The Pfizer example that requires ultra cold chain right now, we understand that Pfizer is now looking at a powdered form of that vaccine, which wouldn't require the ultra cold chain. Moving from 2 doses down to 1, figuring out alternate delivery systems. One of the partners in our coalition, IAVI, is working with Merck to advance research on a product that might be an oral vaccine. That would be a game changer and help solve some of the challenges on pharma-grade glass sort of supply chain issues. So just to say, I mean, there's a myriad of challenges. It's promising and absolutely incredible that the science has moved as fast as it has, but still a lot of hurdles to get through. And I'll say, even sitting here in the United States as a mother of 2, I'm very eager to see all of these sort of leading products that are going through regulatory review for emergency use authorization roll into pediatric clinical trials. Virtually none of the vaccine candidates out there right now is pediatrics yet, and that's a big concern for those of us as parents who do not plan to go back to work until we know that our kids can be safely vaccinated. So again, just kind of giving an outline and an overview of what we're tracking with the barriers to equitable access and what we mean by that. And of course, price is a part of that as well, but I think that that gets a lot of attention, and we're more focused on the logistical barriers in terms of the R&D processes. And we hope that after COVID is done, that there will be some sort of an interaction review of this ACT Accelerator. It's not formally an institution, it's a partnership, and does this type of collaboration, was that more bureaucratic, or was that actually helpful for advancing global cooperation to get past COVID-19? Next slide. So coming up a level from the immediate concerns we're trying to grapple with to looking at where do we go from here? How do we support the broader architecture and looking at preparedness moving forward? We're definitely, I think many stakeholders are agreed that mobilizing sustainable financing for global health security R&D capacity building is part of the solution here. We've looked at a lot of the World Bank's activities, especially in the last several months. They have a health emergencies preparedness and response multi-donor fund that is working on short-term solutions for COVID-19. So that's been a little bit of the Band-Aid in the short term. In the longer term, we see a real opportunity for the establishment of a global health security challenge fund and looking at other sustainable mechanisms. And we actually think that the global health security agenda could be the policy framework for saying this is how you look at capacity building across health security, and this is where R&D investments could come in. And then looking at other R&D investments eligible for financing from World Bank and international financial institutions. We've also seen different regional banks take a lot of efforts, make a lot of direct investment in COVID response. What we'd like to see is some of those investments pivot to be long-term sort of sustainable investments. And what we're talking about is how do we strengthen laboratory capacity? How do we strengthen manufacturing capacity? We don't think that every country in the world will have an mRNA vaccine manufacturing capability, but we fundamentally believe that every country needs to have a pathway to get access to the tools they need when they need them. And in face of a lot of the vaccine nationalism, the PPE nationalism, the medical supply nationalism that we've seen this year, there probably need to be regional partners that are really bolstered and strengthened to serve as those hubs for the geographies and serve sort of a network of countries around them. Next slide, please. Global health security agenda is our other midterm priority. So the global health security agenda is this agreement and partnership between over 64 countries around the world saying we're going to have collective action to strengthen health preparedness. And Chile, as you'll see, I've highlighted it there in the list, is a party to the GHSA. And actually, Chile is a particularly interesting country and stakeholder to me because Chile had been previously very involved in a medical countermeasures action package. So how do we ensure that we have all the tools we need, both in terms of preparedness and response? What GHTC has tried to do, and going back to my original statement that there's no global framework right now, zero in the world, that really take into account global health R&D capacity building, we'd like to see that built into the GHSA framework. And 3 years ago, we tried to do this. We tried to get enough political will and consensus to create an entirely new GHSA action package on R&D. And that was unsuccessful at the time. I think there was a lot of interest. No one disagreed that R&D should be part of the framework, but there wasn't a lot of political appetite at the time for countries to sign on and take a leadership role in advancing that action package. So now what we're doing is looking at existing action packages like this medical countermeasures one and saying, is there a way that we could revamp that? Is there a way that we could look at some of the R&D metrics that Dr. Kilmarx and his colleagues have advanced and use that as a framework to drive the conversation about how we need to bolster investments in R&D capacity building? And since Chile in particular had been a really active participant in that medical countermeasures action package in the past, my one plea and call to action for those of you on this call is to say, how can we restart that dialogue with Chile? How can we bring Chile back into the conversation and talk about not just medical countermeasures, but making sure we have the investment in R&D for the medical countermeasures. So we'd love to continue that conversation with all of you offline and in the future. Next slide, please. And just to try and sort of tie up where do we go with the ecosystem, a few things that we're tracking and that were in the recommendations of this Pandemic Action Network report. How do we look at a forward-looking architecture to strengthen R&D coordination and response? We talked a little bit about the financing mechanism. We've also been very actively tracking the work of groups like CEPI, the Coalition, the Epidemic Preparedness and Innovation Initiative that has brought together a lot of R&D efforts and scientific collaboration to advance products. We have looked at whether that organization's mandate needs to evolve in the future to be a permanent global hub to coordinate and advance some of this global scientific exchange, research collaboration, and ultimately product development. So we'd love to discuss that more. There's definitely pros and cons to every model that's being proposed, but having a hub that's outside of WHO that's really coordinating the research would be helpful. We see WHO as really important in terms of playing a normative role. The work that they've done on regulatory review, creating target product profiles is really important, but if they're serving as a regulatory body, it's complicated for them to also be driving and calling shots on the actual product development processes. So we see this as a distinct effort. We're looking at establishing that global governance framework for R&D for health emergencies. GHSA is our medium-term solution, but we'd like to see something strengthened, whether it's permanently sitting within the WHO or some outcome of the ACT Accelerator partnership. We also have been looking at international health regulations, joint external evaluations, and any of the tools that have been used thus far for countries to consider how prepared they are for a health emergency. Again, no R&D metrics really are baked into any of those. We don't necessarily think that the entire treaty of IHR needs to be renegotiated, but we need to take a fresh look at implementation and think about where does R&D and making sure that every country has a roadmap and a pathway to get the tools when they need them needs to be part of that. And there's other broader mechanisms. There's a Sustainable Development Goals 3 for Health Global Action Plan R&D Accelerator, which is pretty nascent, which could serve as a hub for advancing some of these conversations. And we're also actively tracking the WHO's independent panel for preparedness and response. We're taking a close look at these processes, and we're talking to them about how R&D really needs to be strengthened and whatever recommendations come out of their evaluation this year. So again, that's a lot. It's a lot of different moving pieces where we're tracking, how does the World Bank connect to the GHSA? How do countries like the United States feed into these multilateral institutions? And how do countries like Chile, who have a really, really important role to play in a lot of these multilateral institutions, what more can you do to be in the conversation so that you, as a country, Chile, and from the regional perspective, are really helping to drive the R&D priorities for your geography. I think it's also really important to note that all of this investment and all of this work in COVID has moved at a remarkable pace, knowing that we really learned about the pandemic and that things escalated starting in February and March. That fast reaction, that fast response, the fact that we have a vaccine just today that's going into our U.S. Regulatory body for review is incredible. That is based on the investments in poverty-related neglected disease research, a broader realm of R&D research in HIV, TB, malaria, neglected tropical disease. And so, it's built on the backbone of existing architecture. We've used that architecture to respond to COVID-19, but after this pandemic, I also hope that we're not looking at everything as just health security R&D investment. We're looking at this more broadly as we are supporting the R&D architecture, which in times of peace works to advance research in a much broader range of health areas, and then in times of war, like we are right now with COVID, is flexed and used to respond to whatever the next emerging health threat is. Last slide, please. So this is a bit of an old photo from an event we hosted on the Hill 4 years ago, but we had done some research that said that 86% of countries believe improving health of people in low and middle income countries should be an important priority for the United States. And I think that if we were to do that survey again this year, that percentage would be even higher. So just to wrap up by saying we're really pleased to collaborate with you, with Chilean government, with academic institutions, with private sector companies to advance this conversation on how we strengthen the R&D ecosystem. and look forward to diving into questions with you. Thank you.
Thank you, Jamie. That was a very good presentation. Just one, again, housekeeping, and I'm going to say this in Spanish. Para los que deseen hacer sus preguntas, pueden usar el recuadro de preguntas, las pueden hacer en español, no hay necesidad de hacerlas en inglés, las podemos traducir. Pero ya hay algunas. So, we do have some questions, and I would like to start by Peter. You said that Fogarty training focuses a lot in training and capacity building in low-income countries. Chile is not a low-income country; it's a middle-income country. However, with this pandemic, the conditions are changing considerably, and you might consider like lots of research within the capital city and in Santiago. But the further you move out of Santiago, there's not that much capacity and there's not much training available. How can we help you and help Chile as a STIC to increase that connection and to expand relationship with NIH?
Yeah, certainly. So thanks. It's a great question. So as I said, we have limited Fogarty resources that we do want to focus, and we do focus on lower and middle income countries, but the resources for NIH are massive, and we facilitate the partnerships with the other institutes for their research and research training activities. So this is our job at Fogarty. We're happy to help facilitate additional interactions, collaborations, funding with Infectious Disease Institute, the Cancer Institute, mental health. I mean, you saw there's 18 different institutes that are funding and collaborating in Chile, and we're happy to help expand those. In our newsletter, I gave the link to subscribe to our newsletter. We have a general health information newsletter, and then the funding newsletter. And that funding newsletter, it's not just for Fogarty, it's all the NIH funding opportunities. It's even other international organizations, their funding opportunities. So we can certainly facilitate more collaboration and more training. And I completely understand about the outlying areas. Even in the U.S., we have states where there's a lot less capacity and have special resources focused on those institutions.
Thank you, Peter. I have an interesting question here that it's sort of in line with what you just mentioned, but one of our participants works at the Faculty of Dentistry at the University of Chile. Her question is, we are the Faculty of Dentistry with the highest scientific production in Chile. How can we network in this new era of challenges like the COVID-19 pandemic?
Well, I can put you in touch with our National Institute of Dental and Craniofacial Disorders.
Perfect. That's good, Anna. So that's your answer, and I'm going to keep that in and help you to get in contact. Another question that I have, and this is maybe Jamie, but also Peter, because this really goes into the public-private associations and partnership. You both, and their mandate is your mandate is improving health to people, basically, right? And health is a priority, especially thinking about lower countries. But then my question is, yes, we can improve health and we can improve research and we can and R&D, but what about access? Because in some of the cases, you have countries where you have the capacity, but there's not much access in financing for people to receive timely and proper health care. And it's the diagnostic part that you mentioned to you. It's like the 7 hours of someone waiting is not something that's happened in one country for a test. And right after COVID, we're going to have long waiting lists for many other diseases that are not COVID, like cancer, diagnostic, diabetes, I mean, many, you name it. So how we can think of improving health, but also how we can provide access?
Yeah, no, it's a great question. And I mean, that is fundamentally what we care about. GHTC actually is just in the process, and I'll share it once it's published, of doing a mini landscape analysis on the impact of COVID-19 on poverty-related neglected disease R&D. And one person interviewed in that report, it was for non-attribution, said that if countries invested as much in their healthcare systems as they did in tanks, we would be in a lot better position. And I think that is true. I mean, I think you're absolutely right that we're thinking about that last mile. Even for Chile, a middle-income country, you're noting the fact that the farther you get away from the capital cities, the more rural environments you get to, it's harder, right? We're seeing that in the United States as well. We're seeing that, of course, in low-income countries. We need to make sure that there are these sustainable investments. Of course, we're focused on the R&D side, but that needs to apply to the clinics. We're thinking of creative solutions that healthcare can be reached. It doesn't necessarily mean it needs to be a brick and mortar physical clinic anymore. Could it be a mobile clinic that's a van that goes into these communities that provides this rollout and access? And I think one of the potential silver linings of this horrible, horrible pandemic is that the whole world is focused on how do you problem solve some of these last mile solutions. I mean, that's the conversation we're trying to advance right now. We think about the fact that in especially low income countries, many people don't get adult vaccinations, right? They don't get an annual flu shot, the way that we do here in the United States. Most of the infrastructure to get a vaccine delivery to the last mile is focused on pediatrics and kids 0 to 5 years old. How does that change when you're talking about vaccinating adults? So what is that infrastructure that's going to have to actually be very quickly adapted and modified to train healthcare workers and get a COVID vaccine out to these most rural, farthest away, last mile communities that may not have running water, sanitation, electricity, or just the resources that are needed. But then after we get through COVID, we will have hopefully had a model where something worked. It wasn't perfect. It wasn't comprehensive healthcare, but at least there's a new pathway and a new sort of logistical effort that's been considered. And I would really hope that then the takeaway from that is, okay, then how do we build on that to broaden the range of all the health areas that these communities need? And maybe the long term is that we actually get a better health architecture, a better public health infrastructure globally out of this horrible experience.
Yeah, just to add, Jamie gave a great answer, but just to add a couple of things to that. Just from my own experience, I worked for many years on the President's Emergency Plan for AIDS Relief, and this is providing funding for HIV treatment and prevention around the world in lower income countries. And we've learned a lot through that about building health systems and providing access. One that has become relevant for COVID is to have people coming in every month to get a medication refill is really not feasible. And you'd think, we want to see them more frequent to have better follow-up and better care, but we actually see better follow-up if we give them 3 months of medication or even 6 months of medication, and especially during COVID, to have someone just have 6 months of medication, not have to come into the clinic as often, is much more effective. So we are learning some lessons about access, and that's just one example of a lot of practical lessons being learned and work that the U.S. is doing around the world in helping that with access. One other point to make is that we've also, with COVID, seen a lot more use of telemedicine. So in addition to like a mobile clinic, actually having real telemedicine. We're learning more with point-of-care diagnostics, self-diagnosis. We have a big new data science and innovation program in lower-income countries, and really, I think, pushing the envelope in terms of what can be done through telemedicine and with mobile health. And then just lastly, I would say, again, the U.S. we're not wrapping ourselves in glory in terms of our example in providing access to care, and really COVID has uncovered a lot of the challenges, the example about waiting for 7 hours to get a test. And so we do need to have some humility in learning from other countries. Thailand, for example, over the last 40 years has developed a very strong community health program in providing access to care and public health at the community level. So it's really we see it really as a two-way street, that we have some funding and some expertise, but we also have a lot to learn from other countries.
Yeah, that's interesting. And you touched something that it's very important about infrastructure. You've seen, especially at INA and NIH, all the research, all the work done by scientists. But now the question is, we have very successful possible vaccines, but the infrastructure is our main issue. We're not prepared globally. We're not prepared maybe for the complete manufacturing, for transportation, doses. So in cold chain storage could be a major challenge, especially in developing countries. In rural areas, like in Chile, a long country with many rural small communities of high. So what models of vaccine distribution are you seeing emerging in the region? Is there any, have we thought about it? Is it planned? I don't know who wants to answer. Maybe it's a tough question.
I can jump in, and I don't know if Peter can add to this. I mean, I think that's why GHTC is very focused on the work of the Access to COVID Technologies Accelerator, right? You've got a partner like CEPI that's working on the upstream R&D piece, and we're mostly spending our time tracking what they're doing. But their partner matched up to that is Gavi, the Global Vaccine Alliance. And Gavi's big challenge that they're trying to solve for right now is exactly that question. So yes, that is there's armies of people between Gavi, WHO, CEPI, and a broader network of civil society organizations, a huge global network of civil society organizations that sort of is working around them as a hub, trying to figure this out. I would note that they looked at the budgets about the resources that have been mobilized so far, and the last report I saw coming out of Gavi a couple of weeks ago is they're trying to triage how they make their investments and how that they get people, the most number of people vaccinated as quickly as possible. They had to make a very, very tough call to basically invest in cold chain at regional city, like capital city levels and regional levels as their first effort on the vaccination campaign, because they need to get to the frontline health workers first. I mean, everyone in the world, the idea behind this partnership and this COVAX facility, which they call it now, is that you get every frontline health worker vaccinated first, and then you get every most compromised population next. And right now, they're still trying to solve for getting the frontline health workers globally vaccinated, which is it's a bit more, honestly, capital city and regionally focused strategy. But in parallel, they are advancing conversations around how do we then hit the last mile? How do we then hit the next most sort of the vulnerable, the immunocompromised population as the next category of that? So they're not there yet, but absolutely those are conversations that are happening at a global level every single day.
So this is not really my expertise, but just a couple of things to add in some of the innovations in healthcare delivery. Just in the U.S., as Jamie mentioned, the issue about older people not necessarily having access to care, and also some of these small doctors' offices, you get 100 doses of vaccine that needs to be at -70. You don't have that many patients, and you don't have that process. So the private sector is really a big part of the solution in the U.S. Major pharmacies, Walgreens, CVS, that are everywhere. And using them, working with them as part of the vaccination is going to be a solution. So I don't know what the analog would be in Chile. If it's pharmacies, if there's cold drink, Coca-Cola, and the beer manufacturers, if they have a cold chain everywhere, this is really a time to be innovative and creative. And I'm just thinking of this, a big innovation we've seen in African countries. They're using drones to deliver blood as their blood bank, that they can't have a blood bank in every regional hospital. So Rwanda has a central blood bank, and then they'll send out the blood by drone. So I don't know if that's a possible solution for some remote areas in Chile where you can have the cold chain freezer in a larger city, but then using drones for distribution. That's my idea.
Well, yeah, sure. That's the point, being innovative. And here's another tough question, because if you have resources, if you have funding, you can be very innovative. And of course, private-public partnerships are key, especially in governments that have been spending most of their resources combating or controlling or managing the pandemic, right? So the question is, who are the key financing partners that are working on vaccine distribution? Because we've seen partners working mostly on vaccine and then on the research, right? But on distribution, besides COVAX, besides Gavi, which are more into like supporting, right? Not just the distribution, but at least talking about access. Is that a too tough question? We still do not know.
Jamie?
Sure. Yeah. I mean, obviously, one of the things we've seen throughout this pandemic is, I mean, I mentioned briefly nationalism, right? We do know that there are a lot of countries that are using taxpayer dollars of their citizens to work on these investments in R&D and distribution. And so, that is a factor we've seen across the globe for those who have some of these capabilities. The reason that the COVAX facility was created was to try and create that global equitable sort of rollout strategy. We are seeing, of course, beyond the COVAX facility, you've got the U.S. working through Operation Warp Speed. You've got the EU working in partnership as sort of a block. You've got a lot of work that's being led by the UK. And of course, there's the efforts of China and Russia and other bilateral countries to advance these sort of vaccine efforts. There's a really interesting resource, and I'll share it maybe with you, Lily, after for any sort of follow-up notes that you send out to the group. Duke University has been putting together an analysis of procurements and deals and dosing, sort of doing a regional map of where this fits. And so I think that could be a good resource. I mean, again, a lot of this does roll back into the COVAX facility, but realizing not everybody in the world is part of that facility, it kind of shows where some of the moving pieces and the players are.
Thank you. I'll wait for that for that information. I have two more questions. I think the two last ones.
Just to add in, Lily. Yeah, just wanted to add in quickly that there was a Reuters article just in the last few days that Chile is actually purchasing, millions, tens of millions of doses from Pfizer, from AstraZeneca, from Sinovac, and as part of COVAX. So there is a lot going on in vaccine procurement for Chile, and especially with the trials that are going on in the country is also an important part of the access equation.
That is true, and maybe this is a conversation we can also try to arrange with the Ministry of Science, Technology and Innovation that has been working on the clinical trials per se, but also Ministry of Health and the Ministry of Foreign Affairs on getting this pre-sales agreement, both with Pfizer, AstraZeneca, as you mentioned, Oxford AstraZeneca, Janssen, if I'm not mistaken, and they have been able to secure several doses both through government purchase itself, but also through COVAX, right, using both. But still, distribution is a question. How are we going to move those vaccines arriving in Santiago to the rest of the country? And following the same protocols, like starting with the healthcare, elderly community, in moving to access vaccines. But again, distribution, maybe manufacturing, regulatory hurdles, as you mentioned, are all problems that need to be solved from now on to the time we get the vaccine in Chile. Hopefully, the sooner the better. But here's another question that I have, and as I said, I have two last questions. One for you, Peter, exactly, but this one is the first one that I'm going to ask is for both of you. The world has been very well prepared on maybe managing disasters, especially if they're natural disasters, right? And as you mentioned, there is lots of training around when we have like big fires, when we have earthquakes, there's also some sort of incident command system, and both starting from the UN, but those are very local. They're not global. We now have a global earthquake. We don't have a global fire season, right? A pandemic, a disease like this one, is global. How we do respond globally? You kind of mentioned a little bit of that before in your presentation, Jamie, but how we can build some sort of a, not just managing the emergency, how do we work response, and how we really work on preparedness, because here we have an issue about preparedness and awareness and education.
Well, I mean, I would say briefly that that would be primarily a role for the World Health Organization, and they're certainly much better than they were with the Ebola outbreak in West Africa. At that time, they tried to manage it because it was health, but they really didn't have the capacity as an emergency response organization, where it's not, it's about this much a health issue, and mostly it's about logistics and communication and management. And so that was not well done. But I would say at this point they're much stronger in terms of their capacity in strengthening their section on emergency response. It's been complicated politically with the U.S. involvement, but we anticipate within a new administration that the U.S. will be back and fully engaged in supporting the World Health Organization.
Yeah, I would agree. And I think the challenge, I mean, when you talk about a natural disaster, you talk about Ebola crisis, everything that we've experienced in our lifetimes has really been a regional crisis, not a truly global crisis, right? I mean, when we talk to CEPI had prepared for, epidemics at a regional level. They hadn't planned on having to deal with a global crisis with the supply chain challenges that happen at a global level, with manufacturing at a global level. I mean, this is just at a scale of magnitude beyond anything in any sector, I think, that anyone has ever experienced. And so we need to acknowledge that is just, nobody in the world had a perfect plan for this. I mean, that's why even I would argue the Global Health Security Index was a really smart framing that looks like it failed. And it's, the methodology and the baseline of that wasn't wrong. It's just nobody had planned this scale. I agree with what Dr. Kilmarx said in terms of WHO. I think this really, this is why the work of the independent panel on preparedness and response is going to be so important in the coming months, to look at sort of sequence day by day, how did this thing unfold, and where are there opportunities to strengthen the work of WHO and the coordination role that they play, the normative function that they play. They're not going to be the single silver bullet solution to a pandemic, but they absolutely should be a focal hub and a focal point for sharing data, for sharing information, for getting member states together to coordinate and say, how are we dealing with this? And then, as I said before, I think the R&D and some of the sort of where the rubber hits the road on the science, I personally think needs to be in a separate entity, but also that has some sort of a global focus, global collaboration with regional hubs supporting it. And I think you could have a Chile serving as a regional hub, working with a partner like a CEPI or a CEPI-like entity that then strengthens those regional ties. So there's that sort of rapid response at a scientific level in terms of getting into the labs, getting into the manufacturing that's happening in parallel to the coordination and the normative role that a WHO is playing.
Thank you. Last question for you, Peter, because we want to be respectful of your time. Can you speak to ongoing engagements conference on joint R&D in health science sponsored by the Fogarty Center and involving Latin American countries like Chile? If you don't have the answer right now, you can send it.
I'm sorry, about particular conferences, or?
If you have any engagements, conference that on joint R&D in health science sponsored by Fogarty and Center and involving any Latin American country or Chile as an example.
Well, I mean, as I showed in my presentation, we have over 1,200 collaborations funded by the NIH in Central and South America, so it's actually quite extensive. We've had more of our interactions have been historically from Fogarty in Mexico, in Peru, in Brazil, but we have, even with Chile, there's one particular interaction that's still ongoing. So I would say to subscribe to our newsletter, look at our website, and you'll learn about things as they come. I can't think of anything in particular coming up that's specifically around Latin America or Chile, but we always have things coming up. We're about to have a webinar on pathogen genomic surveillance, so using the nucleic acid signature of SARS-CoV-2 to be able to trace where the infection's spreading and to learn about how to prevent it.
Oh, that's very interesting. Well, thank you so much. And I have to say that I've been to NIH in Washington, in the States. I've also been to the Fogarty, and I learned a lot. I know that there are programs, researches. The Cancer Institute is one of the big supporters of children research, and there's lots of collaboration in that area. And I know that one interesting thing is, of all those 66 studies that you mentioned, they're not all focused in Santiago. They are around the country. So sometimes smaller universities that are outside Santiago, like in Talca, Temuco, or other places, do have programs with NIH. So we would love to help both of you to increase engagement with Chile. I think it's our role. It's a good way to deepen our bilateral relationship and to think about the future. We learn our chair mentioned that science has no borders, but also threats and diseases have no borders. And we learn with this pandemic that we need to be way more prepared. So thank you for your time. And I don't know if you want to say that's few words.
Just to thank you. Thanks, Lily. Thanks to the whole embassy staff. And I've actually enjoyed very much co-presenting with Jamie and learning in more detail about what she's doing. We're really kindred spirits in this work. But I hope next year we can do this again in person.
Definitely, we'll bring you here. Totally, both. That sounds lovely. We will be very happy to leave Washington, D.C. once this is all over. And again, reiterating my thanks to the embassy. And as I mentioned, in particular, I think there's an opportunity to follow up with the Chilean Global Health Security Agenda leads. Those conversations are moving within the next month. And I think my specific call to action would be to see if we can engage on that front in the near term.
Thank you. Craig, do you want to say goodbye? And Lucas, thank you so much. You're not in the screen because you're doing all the technical work. So thank you.
Again, just want to reiterate our deep appreciation for your presentation and for sharing your expertise and for offering kind of a way forward for us to all consider as we all confront the challenges of this pandemic. Really appreciate your time, and thank you so much for participating today.
Thanks very much. Stay well, everybody. Hang in there.
Bye.
Bye-bye.